Good afternoon, everyone. Welcome to the Prairie Mountain Health 24-25 Annual General Meeting. I'd like to begin with a land acknowledgement of the land upon which we work, live, and share with each other. Prairie Mountain Health facilities are located on Treaty 1, 2, and 4 territories, the original lands of the Dakota, Anishinaabe, Cree, Oji-Cree, and the national homeland of the Red River Métis. Prairie Mountain Health acknowledges the harms and wrongs of the past and is committed to providing culturally safe healthcare that is without racism or discrimination. Prairie Mountain Health recognizes that improving the health status, health outcomes, and equitable access to quality healthcare for Indigenous peoples is essential to achieving Prairie Mountain Health's vision of health and wellness for all. We dedicate ourselves to moving forward in partnerships with First Nations, Métis, and Inuit individuals, families, and communities in the spirit of reconciliation and healing. Thank you. Prairie Mountain Health operates under the direction of a board of directors appointed by the Minister of Health. The board's mandate and responsibilities arise from the Health System Governance and Accountability Act. The Act provides the legislative responsibility and authority to plan, manage, deliver, monitor, and evaluate health services within the region. The board does this in a variety of ways, including providing sufficient oversight measures and ensuring the organization's accountability by monitoring and evaluating its performance. This includes interacting and communicating with its stakeholders, partners, and also the general public. Although board members reside throughout various communities in the health region, they represent the entire region at the board table. Our current board of directors has 11 members, 9 of which you see here, and the addition of 2 new board members who joined us in September, Vaughn Wilson and Premal Patel David. Completing their terms in the past year were David Morio, Wanda Sandy, Wade Schott, Janan Knight, Shep Castra, and Carla McLean. We'd like to take this opportunity to thank the board members who completed their terms in 24 and 25. The board oversees the establishment of regional strategic priorities contained within the strategic plan. Performance measures and major initiatives are monitored on a regular basis. This is done through a committee structure dedicated to the areas of concern, and those report back to the board as a whole. I'd like to identify the Finance and Audit Committee, continue to review the management's plans, processes, and systems necessary to obtain reasonable assurance that financial risk is being effectively managed and controlled. The HR Committee, that'd be Human Resources, has priorities within Prairie Mountain Health with respect to recruitment and retention policies designed to make the workforce of PMH more reflective of the population of the province of Manitoba, with special attention to Indigenous peoples and to meet the needs of the Francophone population of Manitoba. The Quality Patient Safety Committee, its structures and processes to monitor and review performance related to quality, patient safety, community impact and input and feedback, and compliance with accreditation standards. Stakeholder consultation is a very important role for the committees as well. Stakeholders meetings are held regularly throughout the region with stakeholders and health partners to discuss local health-related issues. Meetings may be held in person or by virtual means. The committees also have community representation, and we have what we call patient partners. We have Brenda Hilco, who assists in the Quality Patient Safety Committee, and Ian Gerard, who is helping with the Finance and Audit Committee. I will now pass the proceedings on to our CEO, Trina Slate.
Thank you, Lon. I am Trina Slate, CEO of Prairie Mountain Health. As we look back over the 2024-2025 year, we cannot help but reflect on the wonderful, amazing dedication of our employees throughout the organization. Without their dedicated, committed service to the people we serve, we wouldn't be able to achieve the excellent results we do. When recognizing staff, I also include physicians who work alongside of us. Our volunteers, the unwavering dedication, selflessness, and compassion of volunteers make a tremendous difference in our community, and the region is truly grateful for their time, energy, and care of the volunteer heroes that of the care that they provide. The number of registered volunteers across PMH is around 990. And the number of hours contributed during 2024-2025 was around 57,000 hours. That program now is really regional in its approach, which is a wonderful accomplishment. Community engagement is truly a strong point for Prairie Mountain Health. We work alongside health partners and stakeholders for the people we serve. A commitment to community engagement for further enhancement of planning is consistently underway. The strategic planning process for Prairie Mountain Health involves 4 pillars, which align with Manitoba Health's pillars for the health system. They are positive healthcare experience for Manitobans with a focus on quality health services, improved health system capacity, performance, and accountability, empowered and adaptable high-performing workforce, and strengthening fiscal sustainability and value for money. This is our guiding path. More information on the strategic priorities and strategic goals can be found by viewing our 2024-2025 annual report on the Prairie Mountain Health website. Among the priorities that we have been focusing on within the region, access to healthcare has been key. We want to ensure that services are efficient, and we are focused on reducing wait times. We support innovation, which is really a strength of Prairie Mountain Health in service delivery. We also want to strive to improve client safety and care outcomes. We align closely and partner in terms of health system planning and service delivery with Manitoba Health Seniors and Long-Term Care, as well as the Department of Housing, Addictions, and Homelessness. The region has been working on disrupting racism and has developed a regional policy on disrupting racism and has activated a steering committee to help guide the activities around disrupting racism throughout the health system in Prairie Mountain Health. We are very proud of our Accreditation Canada standings this past year, where we met 97% of the criteria that was evaluated. There is continuous quality improvement ongoing and accreditation readiness every day, as we will be engaging in a provincial accreditation process with annual accreditation review. Recruitment and retention remains a consistent goal and priority for Prairie Mountain Health. We have developed a 3-year health human resource plan where recruitment and retention of staff is key. Collaborating with communities and stakeholders is a key enabler of the work we do. We cannot do it without others, knowing that there are great challenges with recruitment of staff to Western Manitoba. The region fosters a strong workplace culture. We support all of our staff to feel valued and part of a strong team. We do this through providing education, promoting safety, and promoting respect and collaboration. We offer a number of employee wellness initiatives, many of which will be focused on later throughout the slides, and you will see photos in that regard. We are very proud of some of the initiatives and events that we've held over the last year and ongoing. Fiscal sustainability, of course, remains a key priority for the region, with a number of cost savings measures ensuring that we have no impact to frontline care and services. We are working hard to reduce reliance on agency nursing staff and overtime for staff throughout the region. As we move forward, we, of course, will continue to focus on recruitment and retention and expansion of our services with our capital projects in Brandon and in Nipawin. We will focus on quality and accessible healthcare services and improving clients and staff safety as well as care outcomes. and of course, the continued focus on financial sustainability of the healthcare system in general, and working with our provincial partners in that regard. So here next, we will discuss our Indigenous Health Program in Prairie Mountain Health. Our Indigenous Health manager reports directly to myself and is part of our executive management team. Unfortunately, she was not able to be present today. So here on our map, we have pictured the 14 First Nation communities within Prairie Mountain Health and the 15 Northern Affairs or Métis communities which are within our region. So throughout this past year, we have reestablished our service-to-service meetings with First Nation and Métis communities. We meet with community health directors and health leaders within First Nation and Métis communities to work together to collaborate and improve health services to ensure services are acceptable to First Nations people and meeting their needs consistently. So common topics of discussion in these meetings include concerns, needs, and resources of services, including growth and disappointment in services, and working actively to make improvements where gaps are noted. We have released a regional discharge policy where we sought engagement and input from First Nation communities, and ensuring that we're working on improving communication in the discharge planning process. We are working to address racism within our system. We know that racism exists within healthcare systems as it does within other structures. We address historical trauma and wounds that have occurred in past and are actively working to ensure that we are supporting people and meeting them where they are at. Mental health services and addiction support are discussed, and ensuring that those services are meeting the needs of people. And there's also opportunity to discuss appreciation and gratitude for the services provided. So in the last year, we've had 62 of these meetings with our team traveling to every part of the region. So key members of our Indigenous health team are our patient advocates. So they play a key role in providing emotional and spiritual support to First Nations, Métis, and Inuit people who are accessing health services through our facilities in the region. We have patient advocates located at Brenna Regional Health Center, one in the southern part of Prairie Mountain Health serving Verdon, Neepawa, and Souris. We have another in the Roblin, Russell Swan River area, and one who services Dauphin and St. Rose. One of the key activities the Indigenous Health team completed this year was the development of smudging bundles, which are located at our acute care sites. And also we are adding them to a lot of our long-term care facilities within the region. So you'll see the kit is pictured here. Smudging is a spiritual tradition that is performed by many Indigenous people as a way to calm themselves and to see clearly and focus. It's an important ceremony to Indigenous people. So we wanted to make sure that this was accessible to people within our sites. So moving back to our community health assessment, this was completed in 2019. There is a new community health assessment that will be completed in the upcoming year. But these are some key data points from that community health assessment that was completed in the past. So Prairie Mountain Health serves a population of about 176,000 people. We have about a 20% population of seniors, which is projected to substantially increase over time. We have an estimated Indigenous population within our region of 17.5%, with 7.4% of visible minority population in Prairie Mountain Health. Some of the unique needs or social determinants of health indicators within our region is that Prairie Mountain Health has the lowest median household income in the province of any other region, and we have the highest unemployment rate of any other region in the northern part of our region. More than a quarter of Prairie Mountain Health residents do not have a high school diploma, and more than a quarter of the children in the northern part of our region live in low-income families. So these are all factors that we consider within our health planning. So I now will turn the presentation over to members of our executive management team. Janet Torticliffe, Vice President of Acute Care Services, Glenda Short, Vice President of Community and Continuing Care, Adrian Fung, Chief Medical Officer, Kevin Carter, Vice President of Human Resources, and Dan McGregor, Vice President of Corporate and Finance Services. So Janet, over to you. Thank you.
Thank you, Trina. So as Trina introduced myself, I'm Janet Torticliffe. I'm the VP for Acute Care Services and Chief Nursing Officer for Prairie Mountain Health. The Acute Care Services portfolio covers 20 acute care sites across Prairie Mountain Health. The number of services provided through this portfolio include services such as critical care services, which provide support for adult and newborn care, surgical services, hemodialysis, therapy services, wound care ostomy. We have a pain clinic program, and along with cancer care programs throughout the region. Some highlights from the past year that I'd like to share from the acute care portfolio is the one being care closer to home. With successful hiring of additional bed utilization resources within Prairie Mountain Health and being a regional program, we've seen improvements with collaboration and communication with all of our acute care sites within Prairie Mountain Health. We are able to ensure that our patients receive their care closer to home, and we've all been able to overall, within Prairie Mountain Health, been able to maintain an adequate bed capacity across the region to help improve healthcare system capacity as well as access to care and services. Another successful component and highlight from the acute care program has been our clinical education team. The regional clinical education teams responsible for planning, delivery, and evaluating clinical education programs and support clinical knowledge of staff, patient safety, and best practices of care across all PMH sites. The clinical educator team is always busy with a focus on timely support to target immediate learning gaps while fostering continuous competency development across the region. A few key initiatives that clinical ed participated in the past year were the successful educational rollout of the discharge policy, which assists with the coordination and services and care to support our patients as well as their families who are discharged home and ensure they're well supported. Another initiative was to update our orientation program for our new clinical staff so that they felt supported when they started employment within our programs, as well as launching a new regional healthcare aid orientation program. The last highlight I'd like to share is our recruitment. Successful recruitment has occurred within a number of new hires within various programs throughout the acute care sites for nursing, healthcare aides, as well as our therapy services programs. Our leadership teams throughout acute care, along with their staff, continues to champion innovative ways to explore recruitment opportunities with their staff, as well as staff engagement and teamwork while focusing on welcoming and retaining new staff who are into our organization. I now will hand over to Glenda Short. Thank you.
Thank you, Janet. Good afternoon, everyone. I'm Glenda Short. I'm the Vice President for the Community and Continuing Care Programs across Prairie Mountain Health. Within our geographical boundaries, we have 43 personal care homes, 10 transitional care facilities, and transitional care facilities provide clients that aren't well enough to go home or maybe waiting placement for a long-term care bed, and 1 rehabilitation unit. Also within the portfolio consists of the community programs of public health, primary health care, home care and senior services, and mental health and addictions. Some of our highlights in 24-25 was the successful opening of the Minor Injury and Illness Clinic in Brandon in September of 2024. This was the first regionally operated minor injury and Illness Clinic in the province of Manitoba. A tremendous amount of work had to be done by the team who adapted a model to meet the needs of Prairie Mountain Health, order equipment, do renovations, hire staff, and open. Collectively, we achieved it. While recruitment for primary care providers continues, we are open 7 days a week, 12 hours a day. We have a physician and or some days a nurse practitioner, a nurse, clerical staff, and social worker who are all part of that team. Clients can walk in or schedule appointments, sometimes on the same day or sometimes within 48 hours. Clients who have minor illnesses or injuries such as sprains or strains, wounds, flu-like symptoms are open to attend the clinic. The Brandon Emergency Department is able to redirect minor injury and illness to the minor injury and illness clinic if clients' needs can be met there and the clients agree to come. We have grown since that first month of 200 visits to around 750 clients per month today. We're very proud of the teamwork that went into that. Also within the community programs, we have a very successful multi-jurisdictional collaboration with partners. We work closely, communicate, and meet regularly with our partnering agencies and all of our Prairie Mountain Health programs. One example of this work is our Northern HIV Meeting Forum, where we work with various programs from Prairie Mountain Health, such as primary care, public health, mental health and addictions, as well as our partners with Indigenous Services, Manitoba HIV, the Department of Housing, Addictions and Homelessness, and other partners to provide HIV programming and harm reduction supports to communities, ensuring that we are communicating and working together for one set goal, which is our clients, helps us to ensure there are not silos within the system. We know that collectively we can problem solve issues together and resolve them quicker than if we were working alone. So those strong relationships help to move us forward. The final highlight I'd like to bring forward is in October 2024, some of our long-term care leaders participated in a provincial education session and workshop on changing the philosophy of care in our personal care homes. Our long-term care personal care homes have been working very hard with residents and families and staff over the years to focus more away from a strong institutional model to more resident-centered care. The education was inspiring. And to hear what some other long-term care homes within Manitoba and other provinces were doing. And it certainly spurred on the Prairie Mountain Health team on to target our choice in what we were delivering for care. Our long-term care homes have been working hard to expand our recreational programming, particularly since the pandemic. They have focused on the decor in our personal care homes and are really working hard with our nutrition services staff in order to ensure that residents have the choice of food and dining options when they come to eat in our personal care homes. We know we have a long ways to go, but we are starting to make changes in some of our long-term care homes. We have a very passionate team of staff and leaders in all programming areas who are committed to safe, quality, and accessible care. We continue to review our programming needs and determine what new or restructured mental health and addictions programs or primary care programs can be delivered across Prairie Mountain Health. With that, I'd like to turn it over to Dr. Adrian Fung.
Thank you very much. So as I said, I'm Dr. Adrian Fung. I'm the Chief Medical Officer for Prairie Mountain Health and the VP for Medical Services. So the highlights for the Medical Services Department in the 2024-2025 year, some of the major highlights are around recruitment, which you can see here. PMH has hired 2 full-time staff dedicated to physician retention and recruitment. That started early on in the 24-25 year, supported by members of the medical services team, administration staff. This group has worked to collaborate with communities throughout our region and to build strength in that collaboration to retain and to recruit new physicians, and has also worked closely with the Provincial Healthcare Recruitment and Retention Office to improve our physician recruitment overall. The staffing of physicians has remained a challenge, and so it was very positive, and it was a great piece of work that was done to recruit approximately 40 doctors over the course of that year to work within PMH communities. So of these, as you can see, there were some doctors recruited through a training program run by the University of Manitoba. These are international doctors trained internationally and then are sponsored through PMH to gain some more training to work within our communities here in Prairie Mountain Health. So last year that would have been 5 doctors through the 2024-25 program, and then another 8 doctors through the 25-26 program. So that has been a piece of it, but that doesn't obviously account for the others in that 40. So of those numbers, approximately 25 doctors were recruited within Brandon, including specialists or general practitioners, and then a resulting 15 family physicians recruited to various areas within our region for our rural communities. Other pieces that have helped to strengthen this in regards to community engagement, as you can see, medical student visits, tours, events hosted by our communities have been a huge piece of recruitment, and the increased engagement with communities to our medical students, to our resident physicians, which are trainee physicians, has been a great boon for us as a region, and I cannot be thankful enough for that. Of note, in the 2024-2025 year was the start of the residency program in Neepawa, where they train family physicians, a 2-year residency program. And we are very excited to see that those first graduates of that program will be coming at the end of this year, this fiscal year specifically. So overall, the challenge remains of physician staffing. We have managed to make a 30% improvement over that last fiscal year on physician staffing, which has been very positive, and we are moving in the right direction, and we are hopeful to see that continue going forward. So next, I will turn the presentation over to Kevin Carter, who's our Vice President of Human Resources.
Thanks, Dr. Fung. Good afternoon. I'm Kevin Carter, Vice President of Human Resources for Prairie Mountain Health. As you can see by the slide, a bit of an overview of the portfolio. I would just make a comment. Essentially, practically anything that relates to employees hits our portfolio in some way, shape, or form. With respect to highlights, obviously recruitment and retention is a high priority for Prairie Mountain Health, as it is for other organizations in healthcare, and it's been mentioned throughout the presentation. So we do have and have developed a 3-year health human resource plan, which is intended to move us to a more stabilized workforce, reduce our vacancies, and reduce our use of external agencies in providing services. Some of the activities being worked on under that action plan are exploring and reviewing our methods to increase communications and presence both in person and on social media, methods to showcase career opportunities and promote stories and positive messaging around healthcare careers to attract individuals to it. We continue to participate and expand our participation in career events. So if you're thinking about or holding events in your community, please reach out. We'd like to be participants in that. We're also looking at developing more PMH-led activities for existing staff to expose them to opportunities within the organization that they may or may not be aware of, and providing information sessions in that regard, so that can lead to some more career laddering and expanding career paths within the healthcare industry. We're also looking internally to improve our job posting application process and enhancing scheduling practices so we can maximize the use of our current resources. We engage on the HR portfolio specific to recruitment and retention, and collaborate with communities, stakeholders to discuss their needs, obviously, but also with educational institutions. We hold and conduct regular meetings with those with the greater presence in our organization, in our region, those being Brandon University, Assiniboine College, University College of the North, and University of Manitoba. We're able to cross-promote opportunities, whether it's in the whether it's in career placement opportunities, practicum placements within our organizations, or arranging job shadows, etc. So we do have a close working relationship, and I think it's been beneficial to both parties as we move forward. Another big piece of the activity within recruitment and retention is supporting international employees. So assisting workers with immigration pathways, also assisting with the work permits in the review and follow-up and ensuring work permits are up to date, and also assisting workers in engaging with community immigration programs closer to their homes to engage support to those individuals settling into our communities. A couple of other highlights with the workplace safety and health. Obviously, we strive to create a culture of safety within the organization. Once we get individuals here, we need to ensure they are working in safe environments, and to support them in that regard, we want to inject safe practices into how we do things on a daily basis to prevent accidents and ill health of our employees. And to assist in that, we are engaged with MASH, which is Manitoba Association for Safety and Healthcare. They're an industry-based safety association that provides consulting services and training in the area of workplace safety, but specific to healthcare organizations. So they assist in enhancing our safety program initiatives to bring them in line with workplace safety and health regulations, and identify gaps that need to be addressed. There's an opportunity for formal certification under that organization, which would also come with a rebate in WCB premiums. So it's a target that we have been working on and continue to work with. Employee wellness, which has been mentioned previously, is another big piece that we would like to highlight. The Prairie Mountain Health vision is health and wellness for all, and we feel that that includes obviously our own staff as well. So the Employee Wellness Initiative and their activities occurs through Employee Wellness Committee and social committees. They plan events, accept applications to supported staff events. We've seen an increase in the number of requests and participation in those events, and are certainly encouraged by the engagement of staff in those initiatives. I was slightly distracted by the picture here that showed up on the slide. So that is from a recent event, which was a trivia event that was hosted in Brandon. We had lots of participation and participation from staff right across the region. So it's events such as that, movie nights, host a beach day in the summertime that is very popular, barbecues, support admissions to activities in varying communities depending on what they have going on, and can be as simple as book exchanges. All of these activities are meant to help to support employees within the organization, obviously with non-work activities, but also to make them comfortable in our organization and help to retain in that regard. So overall, we are seeing some positive trends on the recruitment side. Our agency use is reducing. We certainly still have work to do, and we continue to work on our recruitment and retention of human resource needs, but we are seeing positive trends in that regard. I would say, despite the challenges that are created there, I think our staff continue to provide a high quality of care, and we look forward to continue to support them in that. And with that, I will hand things off to Mr. Dan McGregor.
Thanks, Kevin. Hi, everyone. As mentioned earlier, my name is Dan McGregor. I am the Vice President of Corporate Services and Chief Financial Officer with Prairie Mountain Health. Programs in my portfolio include capital infrastructure and support services, business and performance and business planning, health information services, finance, nutrition services, environmental services, and materials management. Some of the highlights in my portfolio include an enhancement to security services in January 2025. Newly trained institutional safety officers, or as commonly known ISOs, began patrolling the Brandon Regional Health Center. ISOs are licensed peace officers and in healthcare environments have additional training in crisis intervention, de-escalation techniques, search and investigation, evidence collecting, and other important skills to provide a safe environment for staff, clients, and visitors. We have many capital projects underway, but I will provide an update on the status of a few of the larger projects in the coming slides. So the first one here, the Brandon Critical Care Building, once completed, the clinical space enhancements will feature a 16-bed intensive care unit on the main level, 30 additional medical beds on the second floor. The third floor is mainly mechanical space, and the fourth floor is shell space for future expansion of services. We are now in the latter stages of construction, anticipating completion this winter, and once the building is complete, it'll be turned over to PMH for staff orientation and training, and we would expect the first patients to be arriving in early 2026. The new Nipawa Health Center is being built east of Nipawa on the north side of the Yellowhead Highway. It will be 4 times the size of the existing hospital and will better serve patients from the broader Western Manitoba geographical area. Features of the new health center include 60 acute care inpatient beds, up from 35 at the current Nipawa site, an expanded emergency department designed to meet best practice standards that include treatment and assessment rooms, trauma rooms, and an ambulance bay, adding a hemodialysis suite with 9 dialysis stations, enhanced space for a number of other programs such as surgery, diagnostics, therapy services, and cancer care. Throughout the build process, there has been consultation with Indigenous groups on facility design, spiritual care space, and artwork throughout the facility. And the site will include a new heliport. We are expecting the building to be turned over to PMH at the end of 2026, with the first patient being seen in 2027. Construction on the expanded and renovated Western Manitoba Cancer Care Unit is complete. The 9,418 square foot expansion features 6 exam rooms and 1 area for minor procedures. Space for the new medical linear accelerator, which is used for radiation treatments, has been used for treatments since November of 2024. The new Paul Albrechtsen Center for Hope is dedicated to providing support and counseling resources for patients. The new Center for Hope will provide therapy services in the form of an additional part-time occupational therapist and a speech-language pathologist for patients receiving treatment. Now to discuss the PMH financial report for 24-25. The Board Finance Committee meets at least 10 times each year to review the financial status of PMH. The committee also reviews the budgets that are prepared by management and recommends them for approval by the Board of Directors. They are also involved in recommending and appointing the external audit firm and reviewing the results of the annual audit. I wanted to say thank you to the 24-25 committee members, Ian Gerard, Lon Cullen, Jana Knight, and Shep Castra, and welcome new committee members for 25-26, Kim Megalhays, Ron Jansen, and Vaughn Wilson. A summary version of the audited financial statements is included in the annual report, and a complete set can be found on the PMH website at prairiemountainhealth.ca under the About Us Regional Reports section. The auditor's report confirms that the audited financial statements present fairly the financial position of Prairie Mountain Health. The auditors issued an unmodified audit opinion, which means that no significant issues were found during this audit. This is the statement of financial position. To note, all of the dollar values in the financial tables on this and the coming slides are all in thousands. To highlight some of the significant changes from last year, you will note that assets have decreased from the previous year by approximately $24 million. This is mainly because of the reduction in amounts due from Manitoba Health. This was related to work done with the province to receive cash due in order to manage cash flow requirements. The liabilities have increased from the previous year by approximately $180 million. This is due to long-term debt related to capital projects. This is offset in the other assets section under tangible capital assets. I would say those are the main changes that we've had in the financial position. Here is the statement of operations. PMH ended the year with a net deficit of $34.2 million, which includes $29.2 million related to operations and $5 million related to capital. It should be noted that the capital deficit is related to accounting practices that result in a timing variance between the funding received and the amortization of capital assets, and it doesn't affect the operating budget. This deficit is largely related to staff vacancies that require nursing agency and overtime expenses to maintain site and program operations. And to note, because we regularly get the question, that PMH incurred nurse agency costs of $35.3 million in 24-25. This chart shows the allocation of expenses between the various programs and services within PMH. To highlight some of the larger expense areas, the large blue area shows that 38% of costs relate to acute care services. The next largest area in red shows 26% relates to personal care homes. 18% in green includes the total for community-based services, including therapy services, home care, community health, and mental health services. 8% relates to physician remuneration, and also to note the miscellaneous expenses mainly are related to items like minor capital and ancillary expenses. This chart shows the various revenue sources for PMH. Certainly most of the funding comes from the province. 87% of the funding is from the provincial government, Department of Health, Seniors and Long-Term Care. 5% of the funding is from the provincial government Department of Housing, Addictions and Homelessness. 5% of the funding is from residential charges from residents at personal care homes, and other revenue includes items such as ancillary and interest income. And with that, that completes the financial summary of activities for 24-25, and I will turn it back over to Carrie.
Thank you, Dan. Sorry, just had to unmute myself there. Questions right now can be submitted to us via via email at communications@pmh-mb.ca, or you can text us at 204-648-4857. You can also email us at any time after the meeting, and we will answer your questions that way. And from here, we have right now one question. So the question is, Virden has been designated as a hub for the Southwest region. We currently have 6 physicians, and we have been informed that there are 9 positions for the hospital. This is what is PMH doing to actively recruit more physicians? I will
go ahead, Dr. Fung. Yes.
Sure. So a lot of our recruitment is around engagement with communities, but also attendance at various conferences throughout Canada and posting of jobs in certain areas. We work closely with the HCRRO office, which is the healthcare recruitment and retention office, a provincial office that was specifically created for the purpose of retention and recruitment of healthcare personnel within the province of Manitoba. These are all kind of working together to try and find physicians who are currently working. For those who are not currently working, who are training, as an example of resident physicians who are trainee physicians, we engage regularly with the residency programs in the University of Manitoba to recruit from that pool, as well as with our internationally trained physicians who reside in Manitoba or wish to work in Manitoba. We are in regular contact with them as well in regards to trying to find pathways for them to work within any of our communities with targets to many of our hub sites, as was suggested in the question, Virden being certainly one of them.
Thank you. We have another question here. How do you recover or get out of a deficit? That's for Dan. I'll pass that to you.
I mean, it's a good question. There's a lot of work being done around that. So certainly, as I mentioned, with the vacancies being the number one impact to our region, we're doing a lot of work around recruitment and retention, and we've developed a recruitment and retention action plan. And I think Kevin spoke a little bit to that, but that's the main driver of the deficit. But certainly, it's not the only one. So we do have a financial accountability work group, and we're looking through a variety of items, trying to turn over every stone we possibly can. So, some of that's around staff scheduling, some of it's around our invoice processing processes, the leases, whether we are leasing space or leasing space to others, what opportunities we have there. I would say that is a main focus of trying to find, every aspect where there are savings opportunities, but I would say the main focus is on the recruitment and retention, because if we can reduce the agency and overtime expenses, certainly that would help the deficit dramatically.
Okay, thank you. We have another question, and this is regarding recruitment, I believe. It sounds like recruitment efforts are working, but would you happen to have the number of new hires that is on your wish list?
Don't know that we've got that broken out by a hard number. I don't know, Kevin, if you've got more to, or sort of information that we can provide on that regard.
We could take that away and get something in that regard. I think the number is still quite large when you look at the region right across and all occupations, but that's something we'd have to take away.
Okay. And what are you doing to address the surgeon shortage at BRHC?
Well, I think in the short term, we are working to try to find some locum coverage, so some short-term coverage of any gap in on-call shifts, and we are working at recruitment to that department.
Okay. How is Prairie Mountain Health improving staff safety in our sites? Specifically, there was a question regarding staff safety in Swan River.
Yes. So each site has their own workplace health and safety committee, which is a group of employees from all programs and services within those facilities. So that is one. Our active engagement and involvement with the Manitoba Association of Safety and Healthcare, so MASH. There's a number of improvement initiatives that we will be engaging in to improve policies, procedures, training for staff, although we already engage in those activities, and actively train and educate our staff on safety and preventative activities. Safe client handling is one example of that. And just ensuring that there's open communication and a culture of safe communication around any safety incidences and reporting in that regard.
Okay, thank you. Kevin, this one is for you. The 3-year action plan that you mentioned, when did that start?
The 3-year action plan, I would say, started probably about, I think in its infancy, probably last fall, but more formally into the new year of 2025. And I would say we're still within kind of the end of year 1 here. But to your previous question and comment, we are seeing some things that are starting to move in that regard, and looking forward to how much we can kind of move the needle, I guess, if that's the right phrase, into what Dan had mentioned. We know that our vacancy rates are a driving force behind our deficits, and every individual we can recruit and get in there is a positive step forward for addressing all of those pieces. So I think we're starting to see some good reduction in our agency use generally. I mean, obviously there are going to be pockets of our region that are still somewhat reliant, but generally across the region, we're seeing positive trends in that regard as well. So we relate that to our successes in some of the improvement in some of the recruitment, but we still got some work to do in that regard.
Okay, thank you. There's another question here. How does Prairie Mountain Health handle complaints?
So we do have a patient relations department that can be contacted. We can provide that contact information for awareness. So either email or phone line to report any compliments or complaints or concerns with care. And then from there, the patient relation coordinators would disseminate any concerns or compliments to the department accordingly.
Okay. Another one. Now with Manitoba Harm Reduction Network no longer distributing supplies in Swan River, how will Prairie Mountain Health handle being the sole provider for this? How many man hours or staff are required to do this? And what are the hours that staff will be distributing harm reduction supplies?
So in all of our communities throughout Prairie Mountain Health, safer drug use, harm reduction supplies are provided through many of our programs and services. So community-based services like public health, primary care, acute care through emergency departments. So emergency departments distribute harm reduction supplies at any time. And some communities have lock boxes where supplies can be picked up. And all community programs operate in most rural communities operate Monday to Friday during work time hours. In some larger communities like Brandon, the community-based programs operate 7 days a week. And so supplies can be available through those programs on the weekends as well.
Okay, thank you. Going back to the how Prairie Mountain Health handles complaints, there's a specific question. Do we have any specific route when it comes to handling complaints about racism?
So part of our disrupting racism policy speaks to the management of complaints and client concerns. And so depending on the nature of the complaint, it would be followed through our complaints processed. If it is Indigenous specific racism, we may engage our Indigenous health employees or leaders within that work just to ensure that we are working to establish trust in the investigation and follow-up process. And we also have our respectful workplace policy where there might be complaints specific to employees regarding racism.
Okay, thank you. We do have a question about how do I access the annual report document. That is available on our website, but what we will do right after this meeting is make it a bit more prominent on the homepage of our website. And one other question, are you able to say specifically where emergency room doctors are going to be working? This question is specific to a doctor coming from out of country, an American doctor.
Where is that specific physician going to work?
Yes.
I don't know
sorry,
if I am
allowed
know
to actually.
Yeah, I don't know the nature of the question. Sorry, I don't think we can respond to that here.
Okay, thank you. I'm just looking. I don't believe we have any more questions right now. So going forward after the meeting, though, people can also still feel free to send us questions at communications@pmh-mb.ca. And if there are no other questions, I'm kind of stalling here to give us a few more seconds. I don't think I have anything else. So I'm going to hand it over to Lon Cullen, our board chair, to close out our meeting.
Hey, thank you very much. This formally concludes the end of our annual general meeting. Thank you so much for taking the time out of your day to participate and be interested in the workings of Prairie Mountain Health. The contact information is available to you and has been recruited. And just as you heard, recruitment is a huge part of what we're doing across the system. And we want to say thank you to all the staff who are involved in recruiting and all the staff who are currently working in the system. Without you, we don't have the healthcare region and the quality programming that we do. Thank you so much and enjoy your day.
Thank you.
Thank you.